is the crepe bandage or elastic cotton version, and we also have the gauze conforming gauze bandage. Now we're going to use these two because there's much more. We also have these different kinds, which is another type of elastic bandage that is a different width. As you can see, they come in different sizes depending on where you want to use it, right? The other one that people know a lot of is the triangular bandage, and although it's not a circular cylindrical type bandage, this is also a bandage, but you find people use it more to help with slings and immobilization of joints. But this can also be used as a bandage if it's folded the right way. So we're going to focus today on the patient who has a laceration on the mid-forearm area. How do we deal with that, and what type of bandage we will use? Now, the elastic bandage, we should focus on using this for immobilization of joints. So let's say afterwards we'll show where our patient has maybe a sprained wrist area, we will be using this one. But for now, we'll be using, if there's a laceration and there's bleeding, that has to be controlled in order to keep the wound and the dressing together. We would use what you'll call a gauze bandage. It's really for keeping the gauze in place of the wound. So I have a little piece of gauze here, right? You should be wearing gloves for this, but for teaching purposes, we're just gonna do the skill. You wanna place the gauze onto the laceration if it's bleeding and control the bleeding. Once the bleeding is controlled, you could ask your patient to hold this in place, and you now can get your bandage ready. So we open the bandage from the wrapping, and one of the things I wanted to make sure and show you, the difference with this one, it's a lot more porous. You could actually see through it, and it gives the wound care a little air to breathe because of the design. You'll notice the gauze is quite porous as well. When you actually applying the bandage, you want to always make sure that you're holding the bandage with if you're a right-hander, you will use your right hand to be pulling onto the wound area where you want to secure. So I will start here, and once I have it, my patient will remove his hand. But in order for the bandage not to become loose, my thumb area here must stay in place, and then I will roll it over. Now this is where it gets a little tricky. In order for the bandage to stay in place, and you want to create a tightening or compression on the wound, your strong or dominant hand will come across a little more stronger while holding the bandage. So when you come in on the other side, and then you can go lower down, right? And you'll continue there until you are completed unwrapping the wound. One of the things that you must make sure to do is not restrict any circulation while you're wrapping the bandage to prevent the wound from bleeding. And that is why it's important to do the particular type training to understand how and why you would not want to restrict the circulation, although you would want to stop bleeding, but not to the point where it's completely restricted. You do not want to do this and try wrapping the person's wound like that and with the excess bandage like this. You always start with the bandage completely folded up like what you saw before, so you'll be able to hold and manipulate the bandage properly to be able to get the compression onto the wound. So we're going to use the elastic bandage now, and this will be for immobilizing somebody who has a sprained joint injury here. This particular type bandage is elastic, and you'll find that it actually keeps the joint from moving up once you apply the bandage in a particular way. There's no, you notice there's no wound on the skin. There's no bleeding, nothing like that. The problem occurs within the ligaments inside the joint. So what we want to do is actually stabilize the joint with this elastic band. When you open your bandage, you'll notice that they have like little pins like this. You could use that, or if you have tape, or you could just, I'll show you if you want, you could just stick it into the side of the dressing. You do not have to use the whole dressing. It all depends on how extensive or